I was having a baby, if I was that young, I'd come here. The happiness, you know, it's a happy place. It's mostly happy here. If it's sad, it's very, very sad. But most of the time, it's a wonderful thing to see babies come into the world. It's very exciting to know that you're a part of a new life coming in.
Ever since I was a nurse, I always wanted to work in labour and delivery. I don't know, it's probably a maternal thing. I probably wanted to be with moms and babies.
The sight of seeing a new human life coming into the world was absolutely mind-boggling to me. I absolutely loved that.
The average day in this hospital is probably about 3 vaginal deliveries, maybe 1 or 2 C-sections, and then rounding on postpartum patients. And you just never know what's going to walk in the door. Some abdominal pain, some urinary tract infections, and then some ER calls with miscarriages and things like that.
When I first started, maybe a patient had a sonogram. And when I initially started my residency, people were not even monitored when they were in labor. Now your average prenatal patient has probably a minimum of 3 sonograms during her pregnancy. Probably has about 12 to 15 blood tests. And will probably be monitored on a fetal monitor 1 to 2 times before labor even starts, and then throughout their whole labor.
More often than not, they go to the well baby nursery, and so we just monitor, maintain the mother after birth, teaching her how to handle, you know, newborns, sometimes they're first-time mothers with no prior experience of babies or children. Right now, it's in vogue for breastfeeding, big push worldwide for breastfeeding. A lot of what we do is education, teaching the mother how to handle a baby, how to feed the baby, look after the baby, and just generally prepare her for when she goes home with her little baby.
It is not a picnic. It does get very busy when the patients come in. It can get a little frustrating at times when it gets a little overwhelming, but that's the nature of the job here. And you take the good with the bad, and when one day it's not busy, the next day it's nice and quiet. And one minute it could be, you could have 10 patients in labor, and the next minute there's none.
It can be very critical. You're responsible for bringing a baby safely into the world, and you're responsible for maintaining the safety of the mother right after delivery, which is a very critical period for both. There's no margin of error.
So, I mean, people learn to get tough. You have to deal with a lot of stuff. You have to deal with, bad outcomes. You have to deal with, fetal demise, when the baby dies before it's born. It's very tough. That's very hard on everybody. It's hard on the woman who's lost her baby, but it's hard on the whole staff. It's widespread. It affects everybody in labor and delivery, it affects all the providers, it affects generally anybody who comes in contact with this poor mother. So it's a terrible thing. So you got to get tough about that kind of stuff, and then you got to forget about it and move on to the next thing, to the next problem that develops or whatever.
And I think it has to change you, and I think it makes you very tough. Women are tough on women. Nursing is a predominantly female profession, and
when I first started here, it was mostly male obstetricians.
When I first started, there were only a few women in my residency program, and when I came up to Nyack, there were only 2 other women delivering babies at the time, out of a department of maybe 15 men.
And through the years, I've seen more women come, and it's mostly women now, and the patients are, happy to see more women because they feel they understand the patient themselves, what they're going through, and what pregnancy and labour and delivery is all about.
Particularly young women. I think that in general they find that women may understand their issues better.
The women doctors have been very busy.
Yeah.
Nobody really knows what the secretary does, but they don't realize how much we do.
I'm the administrative associate here on the mother baby unit. I'm the all-around hub here. I mandate the charts and I take care of the visitors when they come.
I do doctor's orders, answer phones, get the charts ready, assist the nurses in everything they need, make sure the unit is stocked with equipment, and give the nurses everything they need to give them the freedom they need to take care of the patients, to do nursing care.
A lot of the nurses are still here that have been here for many, many years. So some come and go, but most of them are here. They've been here for years.
17 years. I've been here for 17 years.
But I also worked up here for 20 years.
Like I said, I've been here over 20-some years.
I've been here for 22 years.
I've worked here 35 years, but I've worked in labor and delivery, let's see, 20, what did I say the other day? 23 years. Been here ever since with my friends.
23 years later.
If you really need someone, like in an emergency this morning, everybody pitches in, everybody's running around together trying to get everything done that needs to be done. You know,
We work together well
as a
as a
team.
team in emergency situations, so we can
There's always
depend on.
personalities. You have personalities everywhere, and we sort of work through that. We know all our personalities by now.
Yeah, and then when we need everybody just
Pitches
clumps
in,
together.
and that's
and
it.
You know, you just have to maintain, you know, you're confident in what you know what you're doing, what you're responsible for.
And probably that's what makes it work, because the more minds you have looking in on things and giving their opinions and their perspective on it, sometimes the more good things happen.
I very much love my job. I mean, it gets frustrating sometimes, you know, you click sometimes. But for the most part, it's great. It really is.
And every little baby that comes in, you just feel like, Jerry, you want to get that, please? Every little baby that's born, you feel like you contributed to them coming into the world. It's very exciting. Very, very exciting.